Okay, we are recording. So thank you all for coming here today. We know that there are a lot of questions surrounding the vaccine and how it's going to be rolled out in Johnson County, Missouri, and continue to be rolled out over the next coming weeks. I am Tara Carlisle. I work here at Western Missouri Medical Center, and I'm the Public Information Officer for COVID-19 Task Force. I'm going to hand it over to the women you guys want to hear from today. So Mary Fout, who is from Johnson County Community Health Services, and Dorinda Dick, CEO here at Western Missouri Medical Center. And please, if you guys have questions, drop them in the chat. We have those there. We've also accumulated some questions that have been coming in, so you may hear some of the questions that you've been looking for, and so we'll share those too. But feel free to ask questions in there, and there'll be an opportunity at the end as well to ask questions too. So without further ado, I'm going to hand it over to Mary.
Hi, everyone. Thanks for joining us. We're going to talk a little bit about the vaccine here in Johnson County. But I just wanted to give a little history on when we got our first shipment and how we've proceeded, what the sign-up process is, and we'll move forward. And then Dorinda can talk about hers as well, because it is a joint effort between us and the hospital. The middle of December is when we got our first shipment, and we were in Phase 1A, which was healthcare workers and patient-facing individuals. So we started vaccinating those individuals with the vaccine that we received. We did just receive one tray, which was 975 doses in that tray. Some of that was allocated to the hospital so that they could get their employees vaccinated with the vaccine. And then we moved on to, in January, moved on to Phase 1B, Tiers 1 and 2, as the governor opened that up. We don't move through the phases until the governor or the state allows us to. He wants to move through those as statewide as a whole. So when we opened up Phase 1B, we started vaccinating, providing the vaccine to our first responders, law enforcement, public works, and then the Tier 2 was 65 and older, and those with comorbidities, health issues, high-risk individuals. We started receiving, we were getting vaccine, it seemed like once a week. So we were getting a tray of 975, and they stated that we would get 5 doses out of a vial, but that has increased, and now we're getting 6. So a lot of times we would have extra doses, so we were able to get more individuals when we set up clinics or went on site to some locations. And with the vaccine that we received when we moved into Phase 1B, Tiers 1 and 2, sorry, Phase 1B has got a lot of tiers to it. We set up our first clinic on January 22nd at the community center, where we were able to vaccinate 500 people, and second doses are going to be coming up soon. We've had 2 since then. Unfortunately, now we're waiting on vaccine. We want to set up those events. Unfortunately, we had 2 or 3 set up that we've canceled thus far because we don't have vaccine. We order on a weekly basis, but we're not guaranteed that vaccine. So it's unfortunate, even though we have those clinics set up, we can't roll them out and get people signed up for them until we know we have vaccine on site. It would be very difficult to call 500 people that you have scheduled knowing that you don't have vaccine to give. So we don't push those out until a couple of days prior, knowing that we have vaccine to give. Unfortunately, we order every week. We were rejected this past week. So we're focusing on getting those that we have given the first dose to, focusing on giving them their second dose. Until we have more and we can get first doses put back out there, we're kind of on a standstill. It's unfortunate. We really want to set up these clinics, and I know the hospital does too. We want to get our communities the vaccine because there is a lot of interest. There are 2 signups. Johnson County here, the health department, we have a survey that individuals can sign up for interest in the vaccine. And we've had, I don't even know what the number is now. We did have 10,000 when it first rolled out, but a lot of those were from Johnson County, North Carolina, Johnson County, Texas. So we had to weed through those just to get, sorry about that, just to get our communities. And so we're going down that list. Those that don't have internet access or don't, are not internet savvy, we're taking tons of phone calls. And we're putting them in the order that we receive them so that we can call them when the vaccine's available one by one to get them scheduled. We realized that the sign up that we were using here at the health department is not working. Unfortunately, we don't have a lot of resources to do sign up, to do surveys. So we it's a learning game for us. We realize it's not working, so we're moving on to something else during this break until we get more vaccine. So that will come out. Carrie probably has pushed out some information on our website, on Facebook. If not, I know it's coming. So I would encourage those that are interested to get signed up either through Johnson County Community Health or Western Missouri. They have a survey or sign up as well where you can register for the vaccine. We're asking the community to do both because who knows who you're going to get into first. The hospital could receive vaccine and we may not. We could receive vaccine, the hospital may not. So we're encouraging everyone to sign up where they can so we can get people vaccinated. I think I'll hand it over to Dorinda to kind of talk about how it's working there at the hospital.
Thanks, Mary. I do want to give a shout out because the health department, honestly, when some of the keywords that she said there, they really have limited resources. It's not a huge agency of people, and they've done a great job really getting this going. Not all health departments have been as effective as they are, and we were really fortunate to be able to partner with them. So as she said, they were able to get us 500 doses for us to do our healthcare providers here in December, and so we were able to do that effectively. We are a designated vaccination site as well, the hospital, and right now 3 of our clinics are designated. And what that means right now is just that I'm able to order under their sites. I'm not giving any vaccine at the clinics at this time because we really are running these as mass vaccination clinics, just as Mary and we've both done, and everybody else in the country is doing as well. Eventually, when it becomes mainstream and probably it's open to the public, we will have the availability for those at the clinics when you just go see your doctor. But right now we have 4 ways to order. And like Mary, last week we got vaccine. And so we were able to have our first mass vaccination event on the 29th, and we vaccinated almost 500 people there. And then we had another event at UCM on Tuesday and vaccinated, I think, 280. And that was all we had. So we've depleted pretty much our inventory. I think we have some left that we have some more healthcare providers that are signed up to get it. But so we ordered again this week in order to, just like Mary, we have clinics planned with some of the local, locations. People have been really willing to partner with us and let us have those big, nice places so we can keep people safe, social distanced, and that kind of thing, and easy access in and out. So we have dates reserved from here to the end of April, and at each week as we get vaccine, we will go ahead and plan those. So how you sign up for us is it is really simple. If you go to our website, it's the very front page. It says click here. It's a little online form and it sends the information. We want to know if you want it at any time, fill it out. So if you don't qualify right now because you're not a high risk individual or you're not over 65, you can still fill it in. So it asks those couple of questions. And then we go first come, first serve all the way down by date and time of when that form was filled out. And as long as you meet the tier, we call you and schedule you for the appointment. If you don't meet the tier, then you just stay at the top of that list. And so when they open up that next tier for essential workers that are teachers and those kinds of things, then we would start calling you. So that is how we're doing it. It has been effective. Mary's clinics have went without a problem, and so have ours. And so we're really proud of our processes. To shed some light on probably why we're slowing down this week. As you know, across the country, each state gets allocated doses based on their their usage. Everybody wants to be effective. They're not, they're not going to send it to places that aren't as effective at giving it. And I think here in Johnson County, we have done a great job because we have been committed to giving it, getting it to the people as quickly as we get it. But the state of Missouri did come out with a new plan. They were working on it late last week. And so they feel like, so not all health departments are as effective as Mary. I mean, Johnson County Health Services, they have a home health. They have a few little services, more people, more nurses than maybe some health departments in some counties in the state. So that had been the main people getting those vaccines, I think, originally. And so they want to change because they want it to go quicker. So they want to get people vaccinated quicker, and they don't want any reason for Missouri to look like we're not vaccinating as quickly as other states. So they have turned to the Missouri Hospital Association to put together kind of a pilot this month of high distribution centers of hospital systems. So great idea. We do have lots of resources, hospitals do, and honestly, nobody's better for that than a community hospital. So Bothwell and Sedalia, us here, Golden Valley and Clinton, like that's what we do. We serve our community. There's many, many places in Kansas City, obviously, but so they did release the list. Western Missouri is not on the list. I apologize. We are not in that first group of these high distribution hospital systems. So really what that means, so it's a kind of a pilot this month. And so they are every week, a different section of them. So like Bothwell, our area, Bothwell, Golden Valley, Marshall, Cass County, that's kind of our region and this rural setting. They are getting their vaccine the week of the 8th and the 22nd. And so they're splitting 5,000 doses between those 4 sites to try and get as many people vaccinated as possible. And so we're not guaranteed those. So 55% of all the vaccine in the state every week this month are going to these high distribution hospital systems. And my plan, and I've been campaigning, is for me to be admitted to that for Warrensburg in March, so that we can be guaranteed vaccine, because they're all able to count on the vaccine when they've been told they're going to get it. We are in this selection called community provider resource. And so only 8% of the available doses go to that sector. So I have campaigned that even though I'm in the community resource section, I have the ability to give 1,200 doses a week minimum. And so I'm trying to increase our chances of getting doses assigned to us. It will make them look good. We can make the state look good. And so I've been trying to encourage them that, let me help you, because we have done a good job in the last week. Unfortunately, I think that there's been some data issues. One of the things that they've noticed in the state is there's been some data delay in getting the vaccines entered. Now, we have done a pretty good job with that, but we put them in immediately as soon as we give the vaccine. I know Mary does too. But then there's another system where you put how much you had, how much you gave. And for whatever reason, I just don't know that we've always been showing up because we're low, lower than the counties around us for our percentage of people vaccinated. And it doesn't feel right. That feels wrong. So they're fine tuning that data. And so hopefully we will be recognized for what the processes that we have in place and can do. And I am trying to, utilize those things with the state level people. We have a great collaboration with UCM, with the multipurpose building. Like, we have a lot of resources here, and we have done a good job in this community and been committed to this literally for a full year now. As everybody knows, we were the second drive-through testing site in the state. Like, this is something that Mary and I have been working on in our COVID task force for a year. And so it's really disappointing that we feel like we're having to wait. But the wait won't be forever. I've cried a few tears this week. And I've been pretty frustrated because we've done well, and I want to keep pushing. And we worked really hard to get the process and people set up to give these vaccines. And so to not have it to give is really frustrating. But the wait's not going to be forever. I just have to be patient. We do have the processes. What I am hearing from their state level is now that they're doing this, they're trying this hospital system-wide thing. The state is now changing things every day. And they are going to get sounds like a centralized list that people can sign up on, and it like connects them to a site with an appointment that's close to them with an appointment time. So there's some things coming statewide. We still have a call center here, our COVID call center, and that's if you can't sign up online, you can call us, we can help you, we can do that for you. We do have live people answering that call center every day, Monday through Friday. So we're here to help. But I think that this month they're going to see how that is, the hospital system is working to give out the vaccines. I have reached out to all of the area hospitals, and Bothwell actually is going to give us 500 doses that they are being allocated the last week of February, which is really nice. It really is a competition. I mean, it really is about collaborating, and they have gotten some National Guard assistance in Sedalia. And so when the National Guard comes, they bring their doses, the ones they've been allocated. And so Bothwell was able to commit to give me 500 doses of this hospital system dosing that's going out. So we will be moving down our list and setting up a clinic the week, probably we were thinking either February 27th, a Saturday at the high school, or March 1st at UCM. So we're working on that, fine tuning that at this time. But meantime, every week, just like Mary, we're putting in our requests and waiting to see if we get awarded those dosages. So
unfortunately, it's a waiting game because you don't know if you're going to get those vaccines if they approve them until I think it's Saturday or Sunday. Sometimes you don't find out until Monday.
It's not a great system. The only week I've been approved, it was a mess. I got 4 emails. I ended up getting 3 shipments. I had another email recalled. It's not super clear. So the state they're going to get better every week also. Unfortunately, this wasn't our week, and we could not be more disappointed, to be honest.
And I'm like Dorinda, I've been talking with a lot of individuals at the state as well, including our representatives and Dr. Williams in getting us vaccine, because we have, like Dorinda said, done a really good job with the vaccine that we're receiving. We're setting up those clinics, and you're not seeing that in a lot of the surrounding counties. I think Dorinda's had 2 or 3. I'm not sure.
I've had 2, you've had 3. So
yeah,
we've had 5
we've had 3. So when you think about that 500 doses being administered each time, we're doing a really good job. So if they could just get us the vaccine, we could get those arms stuck. So yeah. I know I'm advocating and Dorinda's advocating, and we are, like she said, just very disappointed that we didn't get vaccine this week.
I did contact also the CEO in Marshall, and we're talking again today about doing a joint event in Lafayette County, because I have 2 clinics, Higginsville and Concordia. So that's an opportunity later this month. I also reached out to the HCA health system, which is a health system that supports us. We have a HCA clinic here in this community. And I reached out to them because they're one of the major health systems in Kansas City getting, I don't know how many thousands of doses. I'm sure they're getting a lot. And I asked them, as good partners, you want to help my community, because I didn't get in that list. So they are considering, I bet you they'll give me some. So I've cried to a lot of people this week, cried and smiled, and because I'm just so disappointed. But people do, like Golden Valley, for instance, I reached out to them and they're like, hey, we got our own people, bug off. I don't blame them. But I did also ask the state if they would consider us for a National Guard event, because they've done one in Sedalia very recently, and they're doing one in Clinton this weekend. So
keep pushing that, because I've been pushing as well.
I'm trying to tell everybody I can, but.
Ladies, there was a question in here. Is there anything that the community could do to support your guys' initiative, talking to legislators, talking to other people in the state level who might be helpful? So that kind of goes along with what you guys are talking about.
I have heard from a lot of people that they are reaching out to the local legislators. I don't know how much impact they'll have. I don't think it will hurt. It doesn't hurt to every county wants it. I think our key point that we're trying to say is that we have been 100% in this for a year. Like our county has been in this. We have been early maskers. We have been, we've done the things, and not every county has. So give us that next tool too, because we have the processes and people and the community that's willing to take it. So it wouldn't be a waste of resources for them to allocate it to our community. So I think that's the difference. It's not just that, hey, Johnson County's not getting any. Johnson County's not getting any, and we have been ready, poised, and ready and working to do this. And so I think it's a miss, honestly, but hopefully it'll be a really short miss, and we'll start getting doses again.
Some questions that are coming in. Is there a cost associated with the vaccine? So I'll let you guys address that, and then I will just ask the next one.
Johnson County, we will not be charging for the vaccine. There won't be an administration fee. We believe that's a public service. That's what we're here to do. So there will be no cost attached to the vaccine that we give.
We're not doing that either. In our mass clinics, we're not doing that. We're not registering you as a hospital patient. We're not, it is smooth, slick process. And so we're not charging that either. Now, I want you to know, though, it is perfectly legal for us to charge an administration fee, which is like $6. Okay. That's what we get for it, I think. And once we start giving these long-term in our immunizations, like in a clinic, like we do now, we do charge that because it comes along with the med when you document it when you're in our clinic getting a visit. That's a different system. But meantime, we're not going to do it. I have heard though, like I think Woods and Sedalia, they were charging an administration fee. And so like my parents were like, I'm not going to go there. That's fraud. No, it's not fraud. There is a workforce component to this. I mean, it takes a lot of people and out of their regular jobs to do this. So it is legal for them to charge an administration fee. It goes to your insurance. If it's not covered, the government, it should not be any cost to you no matter what. No matter if somebody charges it or not, it should not be any cost to you is what I've been told. So.
Okay, thank you. Next question is there going to be availability for the second round of vaccinations for those who have already received vaccine 1?
There were some concerns with regards to whether or not we were going to get that shipment for those second doses. However, I received some communication this week with regards to that, and I have been guaranteed that the doses will be here for that second round. So
when you get the first dose, it automatically reorders you a second dose. Now there was talk that they don't want those waiting on the shelves for people, and they were just gonna get them out because we'd be safer if everybody had a first dose. But that hasn't changed. So Mary and I have no reason to think we will not have our second doses available.
Okay. The next question I'm seeing coming in, and I've seen this a few times, some of the school districts that are in 1B, Tier 3, the ones that are coming up, UCM, local school districts, what is the plan for them? Are we going to work with them from the county level reaching out, or are we going to request that they fill out our forms for signups?
I think we've already got some communication with the schools with regards to how that's going to happen. I know Carrie works with the schools a lot, phone calls, communication wise. So we have several, like UCM, Warrensburg School District. We have several that have filled out a survey to let us know, because not all staff members and employees are interested in the vaccine. So we have numbers and we need to plan accordingly. So when they roll out that tier, we will be contacting those based on the survey. And we have a list and we can send out. I know the hospital will probably be working as well if they have the information.
Usually, Mary though has a good process. If you're a group of more than like 50 employees, you guys were making appointments with that company. And so we both have the ability to do that for those bigger employers like UCM, the school district. And so I suspect once the education sector we're in that tier, that it will take both of us to help get both of those two big sections done. Not to mention, not just in Warrensburg, but we have the whole county. So,
but it will be very similar to the mass vaccination events that we're holding. We'll go off site to those districts to administer the vaccine.
Okay. So there is some questions about the fact that this is not true FDA approval. It was more of an emergency type FDA approval. So clinical opinions based on that. And then the question was, why would we not push immune boosting vitamins? And what is your opinion on the vaccine as a whole?
You know, I'm not a physician, and I'm a nurse. I mean, I know some things, but what I do and what I'm encouraging people I love to do is listen to the medical professionals that are really trained at reading the literature and reading the details. And so for me, as a health leader, Dr. Dave Glover and Dr. Brad Carper have been my two right hands. And so they do all the research around this. They don't just watch the news, because if you're watching the news, you're not getting the accurate picture. You're getting a lot of extraneous things that can really skew the beliefs. But if I had cancer, if I had diverticulitis, if I had anything, what I would be doing is listening to my physician. It's always a good idea to boost your immune system with vitamins. That's baseline. But I listen to my medical professionals for advice. And so what they're telling me is that this vaccine is necessary, it's safe. There are people, it's a personal choice. I mean, there are people that have read things that are in targeted journals about, fertility and those kinds of things. And so they've made a choice to wait, and that's fine. But for the masses, we're trying to decrease spread and obviously save lives of those high risk people. And so, which is obviously why we've started with the sections that we've started with. So I think, yes, take vitamins. It is a personal choice, but I would consult your physician if you have any questions. But some physicians are more educated than others. And so as the hospital system, we have been really leaning, especially on Dave Glover, who has done extensive research and reading about this. And he's not just reading this on Huffington Post. You know, he is reading this stuff in peer-reviewed medical journals, and so it is recommended. And every body that you look at recommends it. Even the ACOG, which is for pregnant women, I mean, it recommends they take it now. So at first they were like, yeah, maybe not. Now they're saying it's a choice, but yeah, we recommend you take it. So.
Okay, next question. And I did also want to mention, I did drop in Dr. David Glover's video that he recently did on the vaccine, and he does specifically address some of these questions that Dorinda had just mentioned.
He does a better job of talking about how the vaccine works.
Yes. Do you have to wait a certain time after you've had COVID in order to get the vaccine?
I've asked that question multiple times to the state, and I've not gotten a real clear answer. But what we're doing, and I'm not sure if Dorinda will concur with this, but we're asking those that have had COVID that they go through the isolation and that they wait 14 days from the time that they were considered recovered before they receive the vaccine.
Honestly, I didn't commit that to memory, but my vaccinators did a lot of research with this, and there is a recommendation out there with CDC, but you have to be recovered. Mm-hmm. And so I believe we're waiting 10 days after recovery too. I don't remember exactly what day frame, but it is recommended. I mean, so some people are like, oh, should I wait because I've had it? Can I wait 90 days? You can, but you can take it too. So.
Perfect. Some questions about what type of reactions we're seeing to the vaccine for those who have received it.
We're not getting a lot of reactions other than like sore arm where the vaccine was administered. A few second doses, headaches, maybe tiredness, but there's not really been adverse reactions where, EMS or needed to report to the emergency room that I'm aware of. Now, I don't know if you've had anything at the hospital there, Dorinda, but there's not been any adverse reactions other than mostly what we're hearing is the sore arm.
So we have a responsibility as being designated vaccinators to report adverse reactions. So if one of our patients had adverse reactions, we would know it. We are seeing those exact same things: sore arm, fevers. There have been some nighttime fevers, tiredness, just general achiness. I've known several people that have gotten some fevers the first couple of days afterwards, but that's not totally unexpected when you take the flu shot either. But that has been like 2-3 people that in our system, and we've vaccinated, many more than that. So headache, that's been a common one. Very few had a little bit GI disturbance, but nothing. I mean, honestly, most people, 3 out of every 4 person around me of the 500 that took it didn't have any reaction except a sore arm. And we've had no strong adverse reactions. We had one person we thought had a rash, but she actually was diagnosed with shingles. So it was like not, but.
Okay, another question that we've received is, do you know the plans for UCM students to get vaccinated?
That will be when they fall into a tier, as we roll out by the state. That's it. We roll out those phases based on what the state does. And I don't have it right in front of me as to where they would fall, whether it would be the general population.
I bet it's general population, because
Yeah.
they're not really in the essential workers, which educators are in. So they might get it where they work. If they all work in food service, they might have the opportunity to take it. So we might grab a few of those, but I don't think it's not a student bucket.
Right. And it's like Dorinda kind of said, you may fall in the general population, but if you have comorbidities or high risk, you may actually fall in a tier or a phase prior to where, you think you would be general population. So we have employers that are contacting us and saying, hey, we filled out that survey. Now we have, instead of 32 people that are interested, we have 27 because they qualified prior to the tier where we actually fall into. So if they qualify and can get the vaccine earlier based on those tiers or those phases, we encourage that.
Going through here and seeing what other questions we have. I know that you guys have kind of touched on this, but if you would reiterate about where people can sign up. Do they have to stay within Johnson County? Can they go outside of the county? What are your recommendations on that?
The vaccine is available for any Missouri resident. And I'm not sure how that is in other states. My guess is it's probably within that state. So as long as you're a Missouri resident, you're not required to get it here in Johnson County. You can get it anywhere in the state of Missouri as long as you are a Missouri resident. So you can sign up, and but there are some places that are focusing on their counties only, or their areas, their communities only. We're trying to do that, but if someone shows up and they're from out of county, we're not going to turn them away because it is for Missouri residents.
We are not. We are keeping track of the zip codes that we're doing, but we're not sorting by that. But let's just say we haven't had this happen, but we were worried, like, what if we get all Kansas City zip codes? Then we would be like, okay, let's make a change. Like, we haven't gotten any Johnson County people. But I think an important point to note, though, is that the way we're doing it statewide, every state has had their own plan. And so when you see things on the news about Florida, West Virginia, those kind of things, every one of those states had their own plan. So our plan is very specific to us. But I think there's some good things about our plan too. Like the way we are having people sign up and have appointment times, that has been really positive. I know somebody who's in Florida right now doing their, wintering, and they have to get on and sign up every morning to see if they're going to get it. Like they have to sign up or call every single morning. So every place is different. And I think that we're on the right track. And I think once our state continues to evolve and get more mature with it, it's just going to get better.
And the state has realized that the health departments are lacking in resources for the sign up and registering. They are getting ready to roll out a navigation tool where individuals can register for their appointment, it's like having an EMR. You put that information in, it reports automatically to the state who's received the vaccine, so they have those numbers as soon as we enter it in. It's going to be a tool that's going to help our department moving forward. We didn't have that in the beginning, so it's trial and error with all these other things, but we're hoping that will roll out fairly quickly. So when we do get vaccine, it will be a smoother transition, because we realize what we're doing now isn't working. However, we have been able to get a lot administered, so we're really proud of that.
And a shout out to UCM nursing students who have helped, volunteered, and they're available to help us and the health department. So that's really helpful.
Yeah, shout out to not just the students, but all the other volunteers that have stepped up to help.
I'm going to go ahead and ask this question, but really just for you guys to reiterate it too. But with signups, and we are recommending that people do not call in to each of these different places. And once you're on the list, you will receive notification. But I know, Dorinda, specifically for us, you could talk about the call center, but and then Mary, you can add on to that too. But I would like to touch on that.
People do call our call center. I talked to a leader that was doing this in West Virginia, and they've been very successful. They've done tens of thousands of doses. And she was like, don't bother with electronic sign up. Everybody's going to call you. She was right. But we do know that people want to be able to call. They have questions. They're concerned. Did my form go through? Because there's lots of questions. And so we do have people designated to answer the phone, and we can help navigate or reassure you, make sure your name's on the list. I get a message almost every day from somebody in the community that says, am I still on the list? Nobody's called me. And so I know people get nervous, but we will call. But if you get nervous and want to call, we literally have people waiting to answer your phone. They were really busy when we were trying to schedule people for these clinics once we knew we had the vaccine. And there was 10 of them on the phones trying to get people scheduled. And it was like Capital One in there, small scale. But we normally, when we're not scheduling, they are there to answer your questions, and they can help you feel more confident that you're on our list appropriately.
We don't have a call center. I wish we did. Unfortunately, we don't have the resources, but we're doing, what was it you said, Carrie, the other day? We're small but mighty. So I think we're doing a really good job. I do have individuals that are being pulled from other parts of the agency to answer the phone and take down that information and get them added to the list. And again, it's very similar to what the hospital's doing. It's the date received and whether or not you fall in that tier and qualify for the vaccine. So we do go down that it's first come, first serve based on that information and qualification. So I think moving forward, once we get that navigation tool from the state, it'll be a little bit smoother. Our phones have not slowed down, unfortunately, and we're sorting them because our county has done a really good job coming together, and we have a plan for what we can do for those homebound individuals that can't get out and come to one of these clinics or, to the agency. So we do have a plan to get those scheduled, and that's using the ambulance district to help us in administering and serving those that are homebound and can't get out. So once we have vaccine, we're anxious to start that.
And I want to make sure you guys don't think that the state, honestly, we were, like, when I talked to Cass, when I talked to Bothwell, I think even Golden Valley, those hospitals hadn't been awarded any vaccine yet, so they were getting it through other agencies, giving it to them, the health department. And so I think we do have some confidence in us from the state level. I'm going to say that. And if they reject me next week, I'm going to take my torch to Jeff City. But
I'll be right there with you.
I would like to believe that they did trust us early, because we have a big clinic system too, employer owned. So it's a hospital owned. So it's, we have the resources, and hopefully they will continue to trust that and get it back to Johnson County.
Okay, I am checking the chat. I'm not seeing any new questions. But I will say if you guys have questions or if you do have one.
I have a couple.
Oh,
I
go
have a
ahead.
couple questions.
Go ahead.
The first has to do with the fact that I looked for 20 minutes trying to find my invite to join. And did anyone else have trouble getting your invites to join on time? Apparently it was just me. I had to send an email message to ask for the invite.
Oh, you're wasting.
Okay.
Sorry, can I add to that?
Yes, please.
I did not receive an invite, but the problem was I put the reminder on my phone and did not, I guess I had to register. I thought it was just you go in and listen. So is there a way to get the text from this forum so I can have answers as well?
Well, I'll go ahead and touch on that. So we ended up, whenever in the morning, we ran the list to see where they were. And so the emails that had registered at like 8:30 this morning, we went ahead and sent. And then Jenny Snap, she went ahead and resent the ones that had came in. So it may have been a little delayed if it was at a later time. But I do want to reassure you guys, we are recording this as well. And we'll be sharing that information. And I fully know that Dorinda and I think Mary would like to continue doing more of these. So we have, set up for Zoom to be able to have quite a few participants, 500 to 1,000, I believe. So we will continue to do that. And I'm so sorry for the delay in finding that Zoom. And also, if you are having troubles trying to find it, we did put it in the event page and we will try to do that moving forward as well. So if you can't find it, just go to the Facebook event page and we'll put it there too.
Yeah.
Okay, my second question.
That I don't think it was we noticed it wasn't as clear as it could be, so we apologize and we'll try to make that link as more visible.
All right, my second question has to do, what old-fashioned types of notification has Western Missouri Medical Center and the Johnson County Community Health used to communicate that vaccine signups are available? Have they only used the Facebook and web pages?
So I can address that. We have actually been sending out press releases to all the local media about the vaccine sign up and how they can do that. So I do believe that the papers have been running that. I also know that Johnson County Community Health and Dorinda and several others have gone on to, including our physicians, to speak on COCO, the radio station. So they normally go on once a month, if not more, for Johnson County Today. And at least speaking from Western Missouri side, Mary or Carrie, do you have anything to add from the Johnson County side?
Well, we've also done, Carrie, you can jump in anytime. We've also done press releases. We were on, I believe Carrie was on the radio a few weeks ago in regards to this. We are trying to make calls. And so, yeah, I think we're using the same sources as the hospital. Now we could probably put another news release out there, our press release, and but we haven't done that because I do believe the process for Johnson County is going to change.
We did hang up some signs too in our clinics. So as you go in to see your physician, there is a sign that talks about where to go on our website to sign up or call. And so that was something we added also.
The only reason I asked that question was in our circle of friends, I had contacted some people last week about the vaccination clinics, and they didn't even know they were happening. There's a lot of people that don't listen to KOKO. They don't get the once a week Daily Star Journal. And so therefore, they're not finding out about this stuff sometimes. So if they're not finding out about the clinics via the media, that's going to prompt more phone calls to both the hospital and Johnson County Community Health trying to find out what's going on. In fact, that's why I made my first call 2 weeks ago, because I didn't know anything was happening.
What would be your suggestion if they're not doing those two things?
Well, you might contact people like F&C Bank, Quarry City Savings and Loan, have those big media boards on the side of the highway. There's a sign company in Warrensburg that has a mobile trailer. Johnson County Community Health has. I think I've seen one parked out there at your office for many weeks at a time that could be utilized in very high visible locations to promote the clinics and encourage patients on people's part after they've registered.
Perfect. Thank you.
Thank you.
I have a question. I was contacted by text message and by email. The first sign up, and within 4 minutes, it was already filled up by the time I tried to get online, and that was at Northside Christian Church. But I did not receive any information from UCM.
The UCM clinic was mine, I think. Mary, you haven't had one at UCM.
We
have you?
haven't. We had to postpone it. We had to cancel it because of the vaccine.
So we had
Okay.
the UCM one, so we don't use the same system, so you wouldn't
Okay.
get text. So ours is just sign up, and then we're just going to go down it. So once you sign up, you only have to sign up once.
Okay,
And
well, I
Casey-
have filled out the survey, both on Facebook, and then I found it online again,
At Western
And-
Missouri or the health department.
the health department.
So,
And I did it at Western Missouri as well.
okay,
But the only text message I got was from the health department, or from Johnson County Health. So I was kind of confused when I heard you say that they had one at UCM.
we did,
And I
but
didn't
we
get
called
any.
the 280 people that were next on the line. So when you come up, you'll get a call too, and you'll get scheduled.
Okay, so when I got in there and they said that was full, I didn't see any place to register at all. So I wouldn't worry about registering until I get another notice.
Okay, so 2 things. So Western Missouri's, if you've already filled out my form on the website, you don't ever have to fill it out again. We're gonna call you when we come to your name.
Okay,
Johnson County's health department is different. So Mary,
So if you filled out the survey, and it sounds like you have because you're getting a text and an email, you don't have to register anymore. We're going to do that a little bit different because it's not, the way to register is not working, because it fills up. There's so much interest that it's filling up so quickly. So we're going to start a new process. So if you've already signed up, you don't need to sign up anymore. You are now very similar to the hospital. You're on a list. And so when your number comes up, you'll get a call.
okay. What if I don't happen to, maybe my phone, I'm in the other room or something like that. Will you leave a message for me to contact you back, or?
We will.
Okay,
We
okay.
won't say what it's for, but we'll ask you to call Johnson County Community Health.
Okay,
That
that'll be
answers
great.
my question.
and we
And
need
you'll,
to-
you'll probably know, if you get a message from Johnson County Community Health, you're gonna know what it's for.
Yeah,
So
exactly.
You just don't want to leave that information on a voicemail.
Sure. Okay, thank you so much.
Absolutely.
To that effect, may I jump in? What number will you guys be calling from? Because I won't pick up if I don't recognize the number.
Well, I can't say what number that's going to be because we have several lines. It's just whatever is available. And I'm not sure if it'll show up Johnson County Community Health or if it'll show up Western Missouri.
Oh, okay, that's fine. I just, T-Mobile told me not to answer any calls I don't recognize. And I'm like, okay, catch
Well,
22. I don't know what to do.
As I said to Mary, I think that's your name.
Karen,
Sorry.
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 Go ahead.
Is that if you have your voicemail set up, we'll leave you a voicemail to give
Thank
us a
you.
call. Absolutely.
that was one of my big questions. I didn't know.
I'm not sure how the hospital comes through. We call from a line that's actually our express care line. So it's probably a 262 number, I would bet.
Okay,
Okay,
that's helpful. Thank you.
are there any other questions on the line?
Can I get a transcript of all the questions that were asked?
I
Is
believe
there- is
whenever
there-
we record this, it does populate those. I'll double check that though.
Thank you.
You're welcome. Okay. Okay. Let me just make sure one more time that there were no other questions. Okay, and I did want to mention too, there were a lot of people that just said thank you whenever they were filling out the form. Thank you for all that you guys are doing for all of us at Western Missouri Medical Center, Johnson County Community Health. I know that there have been a lot of people that have worked really hard to put these vaccine clinics together. There have been staff that have been working hours and long nights, long days to plan an event in a matter of days for 500 plus people. So thanks to everyone, and thank you guys for being here. Please let us know if you have any additional questions. We will make sure to put information on the JOCOMO page and all of our Facebook pages, but I would like to mention that this page, the Johnson County EMO emergency operations page, is going to be the best place. And I think I linked that, but I'm going to try to refresh it real quick and link that in here again for you guys. So that is where we share all joint efforts in relations to COVID and anything for our county. So I just linked that in there for you guys.
I see it. Thank you.
You're welcome. You're welcome. Okay. Anything else, ladies, that you'd like to add?
No, I just want to thank everyone for being here. And again, we're available via email or call. You can go out to our website, find information. There is a link you can click with, and it will provide all kinds of COVID information where you can sign up, register if you haven't already for information regarding COVID. And I know the
Where was that again? Sorry.
I'm sorry?
Where was that again?
It's at Johnson County Health.
Oh, okay. I think I already did that.
Yeah.
And honestly, I just want you guys, thank you guys very much for being such a supportive community through all this. And I want you to know, I hope you leave here knowing that we're really committed to making sure that we try to serve the community, because we really, I mean, all the work we've done is for naught if we can't get the vaccines and keep moving. So we really are committed to that. That being said, I'm already working on plans. If we don't get vaccine, we have to communicate with our people how to sign up for those other clinics in Clinton and Sedalia, because I know that our community needs to get vaccinated. So we don't want you to be waiting on our list if we're not going to get the vaccine. So we are working hard. If we have to take our list and talk with Bothwell and integrate our list, you know, there, like that's the kind of things that we're looking ahead for, because we just want to make sure we're taking care of this community.
Absolutely.
Okay. Well, thank you, Mary and Dorinda, for presenting here today. And again, we will save this recording and put it on our JOCOMO page and both of the sites as well. So have a great day, and thank you all for being here.
Thank
Thank
you.
you.
Bye, thanks.